Very good morning. I will tell you yet again good morning because indeed it is a good morning. Regardless of the weather, we need to just come up and deal with it once and for all. It kind of has mood swings. Leo kuna nyesha, kesho kuna baridi, kesho kutwa, kuna jua and stuff. But we need to embrace the day and make the most out of it. My name is Samuel Njoroge and this is the only way to start your day. Good morning, Kenya. We're right here on a Tuesday from 8 to 9. You know the drill. We usually discuss health matters, and this very morning would like to be proximal and sensitive to the point in time where we are right now. The season, it's very cold, and usually during this kind of weather, various conditions come up, various infections. We are able to get or get various infections. How are you able to manage them? Ni mingi sana. We are not able to talk about all of them. But today we will zero in on two. Okay? That is asthma and common cold. But again, the clinically term for that is coryza. Okay? So we shall deal with asthma and common cold. You got any kind of question? In as far as those two topics are concerned, all you need to do is to hit the hashtag Good Morning Kenya on Twitter and also find me on SMS. That's 22162. Begin with the initials GMK. I've got the pleasure of having a clinical officer with a wealth of 5 years of experience. His name is Peter Okumu. How are you, sir?
Fine, thank you.
Uko salama kabisa?
I'm fine.
Welcome to the show. And earlier on, I was just having this back and forth with part of the crew up there about coryza. Tuambie tu, sini homa?
It's true. Coryza is homa, common cold. We call it coryza on our side, but the public know it as coryza. It's a clinical condition that presents with so many symptoms associated with this kind of weather. It's common cold because the name was coupled with the weather during cold season.
Right.
It's a viral infection that normally present with sneezing. You have a lot of sneezing. You have a nasal blockage. You may have sore throat. Sometimes you may not have. So coryza is self-limiting. At times is a type of condition that you can treat or you cannot treat. It will go. With a lot of knowledge on coryza, you can manage it at home. You need to isolate yourself. You need to use serviettes. You don't need to use handkerchiefs. You don't need to take antibiotics for coryza unless there is confirmed superinfection. Yes.
But again, you see, with the common cold, let's just call it common cold for purposes of this discussion. You say there is no need for us to take antibiotics.
Cool.
But then you find most often than not with our Kenyan culture of self-medication, over-the-counter is our thing. Niko na kahoma kidogo daktari Piriton, you know? Does that mean that it's not something that is recommended?
Fine. Piriton is antihistamine. It's not an antibiotic. I would recommend that if you have a bad common cold, I want to call it that way.
How bad? Okay.
Yeah, with a lot of sneezing, you have a lot of running nose. You can't stay comfortable. I would recommend that you go to the hospital because before the treatment is initiated, because you want to go the medical way, you need to be examined. You need to be examined whether you to ascertain that you have a throat infection. Yes, somebody will examine your throat, will palpate the lymph nodes, check if that is the throat, check if there is any inflammation. A sign that can be a sign of superinfection. Fine, it is a viral infection, but because there is a lot of secretion, that secretion may be a good condition for bacteria to thrive.
Yeah.
Yes. So that can necessitate you to go to the hospital before you start taking the Piriton.
The Piriton.
Yes.
Which is an antihistamine.
Which is an antihistamine.
Not an antibiotic.
As opposed to antibiotic.
Why is it that it's usually triggered by the cold weather. What is it? What is the direct relationship between cold weather and coryza or common cold?
As I said earlier, that it's actually the common cold, and it's a viral infection. You realize that some of these viruses and bacteria are in our body, and they are normal flora in our airway, even in our mouth. When we talk, we discharge them to the environment. When we laugh, okay, when we breathe them out. But thank God for the sun. Because when sun hits the air, there is circulation. So the air that is down will go up above our reach. So the heated air will go with the pathogenic organisms or the disease-causing organisms. So that is why we can't get coryza. We don't get common cold during hot season. But during cold season, what happens is there is cold air. So the circulation is low. So we tend to get the the cold air at our level. So we will re-inhale what other people are discharged. In that case, we will get this we'll inhale these pathogenic organisms, hence we'll get the infection. Yes.
Now I get it. So
that is the reason why we get this common cold or such kind of respiratory tract infections in a congested place.
In congested spaces.
Yes.
Actually, that is where I was heading. So during the hot season,
yes,
it is unlikely that you get common cold.
It's unlikely.
It's highly unlikely you get common cold.
You can still get common cold?
It's a rare occurrence,
yes,
but it's highly unlikely.
Correct.
But then again, you will find that there's so many people who confuse a common cold and flu. Actually, most of them say, I have a flu. I have a flu. Is flu another name for common cold, or there's actually a distinct difference?
I can't I can't differentiate them too. I can't say whether flu is a common cold, but what I'm very sure of, most of these upper respiratory tract infections are viral, especially the one we get during cold air, cold season, are viral. So whether you want to call it flu, whether you want to call it common cold, we will make our diagnosis in relation to the presenting symptoms. Yes.
And what are some of the presenting symptoms for common cold?
One, you will be sneezing a lot, okay? Because it triggers the allergic inflammatory process in your airway. So you'll be sneezing a lot. Try to expel what is the pathogenic organisms out. When you sneeze, you discharge them again to the environment. And that's why I recommend also that you will have some tissue, you isolate yourself. Don't sneeze on your hands, because you're contaminating yourself, and when you greet another person, you will spread it.
Yeah.
Two, you'll have nasal blockage, very bad at night. People will have difficulty with the breathing, difficulty in breathing, especially at night, because of that nasal blockage. You will have cough. Cough may be there or may not be there. Some will have sore throat, depending on the severity of the infection. Yes.
So you said severe
sneezing,
sore throat, nasal blockage. Occasional sore throat may manifest in some cases versus others. Which is the fourth one?
There is a running nose.
A running nose.
Running nose.
Yeah, running nose. So there are four.
Yes.
It's good that our viewers know that. It manifests in terms of severe sneezing, running nose, nasal blockage, and of course, in some cases, sore throat.
Yes.
We say in medicine, prevention is better than cure. How can we prevent ourselves from getting common cold? What measures can we embrace?
To prevent getting the viral infection, avoid congested places. Two, again, self-medication sometimes prolong the symptoms. Okay? Sometimes prolong the symptoms. Three, if one is infected, especially in the family, don't go close to your children. Because these viral infections, they thrive in low immunity. We expect children and the old age, extreme of age, to have low immunity. So they will easily contract the infection from you. So isolate yourself. This is the time you want to seek permission from work, just to stay at home until just 2 to 3 days. It will be gone.
Okay.
Again, you should not use handkerchiefs. Just use disposable tissue paper or serviettes to wipe the running nose.
Okay.
And discard.
Why is it not advisable to use handkerchiefs?
There is issue of contamination that I was telling you earlier, that you should not sneeze on your hand. Handkerchief will you'll be sneezing, you'll be expelling all that mucus content into the handkerchief, which you will reinfect yourself with the dose when you blow your nose. Again, you are likely to infect another person using your handkerchief. Yes.
But now you recommend we use either serviettes or disposable tissue.
Correct.
Actually, let's call it disposable tissue.
Yes.
But then you find that in some cases, this disposable tissue could not be of fine quality, whereby at times it leaves you with, it looks like, what can I say, it's fluffy and has that kind of dust feel effect, whereby if you use and then you inhale, it triggers more. Isn't that a concern then?
Yes, that may be a concern, and that may not be a concern, because there is a good tissue outside there.
Good quality.
Yes, there's a good quality.
Maisha nilo utachagua bana, you know.
There's a good tissue. There is good quality outside there. Yes. So if you have issue with the dusty one, go for a good one.
Actually, the bottom line is invest in good quality.
Yes.
And we're good to go.
By and large, you don't need even to blow your nose. You just need to wipe what is coming out. Wipe and dispose. Wipe and dispose.
Because that is something I wanted us to talk about, Daktari.
Yes.
The treatment of the nose when you're having a common cold or when you're having this viral infection. There are people who really blow hard. There are others that just wipe. So what is the medical recommendation for this and why?
I would tell you why you should not do some of the things you've said. And to start with the people who really blow a lot. You see the mucus that you secrete come from a certain gland, and they keep coming out. They're secreted when you have inflamed sinuses and the rhinuses, this mucus content keep coming out. In fact, they are very light in initial stages of infection or of rhinitis. They are very light. So there is no need for you to blow your nose a lot. They will come out. So you are just supposed to clean from outside. The risk of why you should not, the risk of blowing your nose so hard is in the nose, there are very superficial veins or blood vessels that are supposed to get, the blood vessels and the nerves are just outside there for you to get the smell. So there is risk of you causing rupture of these vessels. So if you blow your nose a lot, you may end up having nose bleeding. Yes. This also applies to those who keep using handkerchief to clean inside with their hands. It's not recommended. You're just supposed to clean from outside. I don't see the need for blowing.
To blow and blow hard.
You should not blow hard.
Yeah, I think it's just a behavior people have of taking it to the 9 yards and blow over and over. And again, it irritates those very glands, which makes it even more hard to manage the condition.
You see, the body has a way of dealing with its problems. Even the secretions of those mucus, if you realize it is a very slight, it's watery, kind of watery. This mucus has immunoglobulin A. Now, the role of immunoglobulin A, sorry to go a bit medical, immunoglobulin A is an immunity in our body that prevents the pathogenic organisms, the organisms that cause disease, from binding to the body cells. Are you getting?
Yes, I am.
So when you secrete a lot of these fluids, they clean the pathogenic organisms. And that's why when you empty this mucus into a tissue or into a handkerchief, it has high dose of the viruses or bacteria, the pathogenic organisms. So when you keep cleaning, you keep blowing, the body will keep producing more because they feel like there is inadequate. And that is why we say you should just clean from outside. Yes. So the body will feel like it has washed away. So you're just cleaning from outside just to for hygiene purpose.
For hygiene purposes.
Yes.
Earlier on when we were talking about prevention, you said self-medication may lead to prolonged symptoms. Let's expound a little bit on that, because we are into the habit of going over the counter and getting medication and just consuming it. So what's the risk in self-medication?
That's a good question. When I say self-medication will lead to prolonged symptoms, I meant that, Kenyans, me included, I don't go to the hospital on the first day that I experience the symptoms. I will wait. Yeah? Let me see day 2, what will happen? Let me see day 3, how is it doing? Maybe I will improve tomorrow.
Sure.
Yes. Third day, I don't feel better. I now rush for some cetirizine, some drug over the counter. The problem with this is, at times you may go take the antihistamine thinking this is just homa, or when already you have superinforced bacterial infection. Are you getting?
Yeah.
So you deal with the homa or allergy while you already have infection of bacteria. So bacteria will thrive because it is not sorted. So you will feel the symptoms, and in fact you will come say, Daktari, this thing is worsening. I've taken Piriton, I've taken paracetamol, I've taken this, but I'm not feeling better. Remember, you started this on 3rd day when the disease has progressed. And that's why we advise that if you feel like you want to take drugs, then go to the hospital. Then you'll be examined by a qualified clinician or doctor who will ascertain that at this stage, you only need antihistamine. At this stage, it seems that it's infection. So we need to add you. It seems that it's bacterial infection. We need to add you antibiotics. Yes.
That's very good to note. A treatment of common cold in adults versus children, how should that go along? Let's start with children. How do you treat common cold amongst children?
Common cold amongst children, you treat also depending with the symptoms. We expect there are symptoms that present in both cases, adults and children. But mostly in children, you will have nasal blockage, difficulty in breathing, because there is the obstruction. So what we normally do is, in children, we start with giving some nasal drops, okay?
Yeah.
Some nasal drops which need to be prescribed. In most cases, we give saline nasal drops, but mostly the child may need to be examined by the pediatrician or the clinician, then they prescribe medication. Mostly we give nasal drops in children, in most cases, but it doesn't mean that we don't give other drugs. But the first line we give nasal drops, and most of the children improve on nasal drops. Yes.
How about
majority.
adults?
Adults will have very severe symptoms, and again we'll treat as per the symptoms. This is viral infection. Are you getting?
Yes.
So we don't treat the virus. Viral infection are self-limiting, most of them. So we will treat, if already there is superinforced bacterial infection, we'll treat the bacteria. Are you getting?
Yeah.
If there is no bacterial infection, you want just to get rid of this sneezing, and this sneezing is your body response. So we'll give you some antihistamine, drugs that will lower your immunity, will reduce the activity of prostaglandin E. That is on your nose, so on your airway, so you won't have extreme symptoms. Yes. So we can get common cold, both of us.
Yeah.
but the way you present will be far much different than you present.
Exactly.
So you get it?
Yes, I do.
It's because of the immunity, sorry. Our immunity are not the same.
Not the same?
Yes.
Would it be okay for some, because I know this is something that is used in offices over and over again. You hear someone saying, niko na homa kidogo nahitaji bed rest. Is it recommended? Is a bed rest recommended when you have a common cold?
Remember I talked about isolation.
Isolation and infection. Contagious.
Yes, it is a contagious infection, of course. If you feel like bed rest is the best for you, perfect.
Go ahead and do it.
Yeah, just go ahead, isolate yourself. Ideally, rhinitis alone, because of the rhinovirus, will go without treatment. You even don't need to take the herbal treatment. It will have to go on its own. But at times we may get infection on top of the rhinitis or homa, as you want to call it.
Yes, let's call it homa.
As you want to call it, you get a infection on top of the homa. So you may need to be treated. Even as you are being treated, you need to isolate yourself. Yeah. People improve. The prognosis is very good. Prognosis means improvement post-treatment.
Exactly.
Is very, very good. 2 days on medication, you are good. In fact, even if we are to give antibiotics, we give very short course antibiotics. Yes.
Let's talk about a common remedy people even use, and they even fix it at home. It's called dawa, where they use the honey, garlic, lemon. What's your take on that? Is it recommended? Is it progressive for someone to use dawa, quote unquote, the concoction, when you're having a common cold?
So you're asking me a very tough question.
I'm putting you on the spot.
I practice Western medicine.
Yes.
Yes. I don't practice herbal medicine. So I will be so wrong to say on a TV that that you give garlic, you give honey, but we know honey soothes the throat and all that. We know garlic. People improve on these medications, those herbal medications. I don't dispute them, but if it works for you, good. But we'll never prescribe for you. Go take garlic, go take ginger. No.
Yeah, because actually, that if you would have said it treats and it's good, I would have asked then why don't majority of doctors just prescribe a dawa? But I guess also the trick is in the health benefits.
Yes.
It's like someone being told, look at your nutrition, consider this for your nutrition when you have a various condition. But then, when you have a common cold, daktari, and it happens to manifest, like you have another disease, but on top of it you still have a cold, is the treatment of it any different?
Yes, treatment may be different.
Okay, how so?
How so would depend with which disease do you have. So what disease or which system is affected by the initial disease? Yes.
Which ones are more likely? Like in your course of practice, which are some of the most combined infections that you've come across as far as common cold is concerned?
Remember I told you that I said earlier that common cold come as a result of low immunity at times. Your immunity has gone down. You cannot secrete. Ideally, like me and you, we secrete mucus that keep cleaning our system. This mucus has protective molecules, which are immunoglobulins. If we don't secrete adequately, these pathogenic organisms get to attach to our body cells. Then we manifest symptoms. So in that case, anybody with diseases that lower the immunity is at high risk of getting common cold. You want to talk of extreme of ages, people on management or on chemo or cancers, people on management of other viral infections like HIV, some advanced stage of other diseases. Yes. Now the treatment will be different. Again, you want to give, if common cold get complicated in a HIV positive patient who is in advanced stage,
Yeah.
you want to give drugs again, considering the drugs they are on.
Yeah.
Yes, drug interaction and all that. You want to give drugs that are friendly to the kidney, to the kidneys and the liver. Those are some of the things that you have to consider. You don't treat them as a very vis-a-vis the normal person. Yes.
It's very important we talk about that, Dr. Manake. Homa si homa. From what I'm getting from this discussion, homa si homa too. I mean,
True.
there's so many things we need to consider. Even when you talk of combined infection, because as you say, drug interaction is very key.
True.
And therefore the need to go to hospital, because your history is important. You need to tell the doctor, yes, as much as this is happening, I also suffer from X, Y, and Z, so that they're able to know exactly what to administer, all right? We need to cross over now to another discussion, because I also faced this question around 10 minutes before we went on air. And somebody asked, okay, fine, in the morning, if I happen to use a perfumed soap, I get nasal blockage. And I was quick not to say that is homa, because it could be something else. So let's talk about that particular condition as we cross over to asthma. What could be causing this very condition?
The smell of perfume, the smell of smoke, the smell of dust, the smell of pollen, we call them allergens. In one group, we group them together as allergens. Allergen is anything that your body responds to and causes your body reject. I think that is the right word.
Yes.
Your body reject. So how will your body reject? Your body will reject it because it will block the entries of that allergen into your body.
Point of
Yes. So the point of entry here is your nose. So your nose will get swollen. Now that swelling is what is blocking now the air from going in. So you will say that I have bad nasal blockage.
Yeah, I'm very sick this morning.
Yes.
Yeah, but it's not a sickness. It's your body reacting.
Yeah, now your body is overreacting.
Okay.
So your body
Throwing a
overreacting
tantrum.
is maybe a sickness. Yes, because when you can't breathe, you are sick.
That's very true. And when it's consistent, or when it's consistent too, it is an issue and it's a problem, and you need attention. But then when you talk of asthma, I have an asthmatic attack. Clinically, what are you talking about? What's the definition of an asthmatic attack?
Asthmatic attack is a group of symptoms. I think I will explain this best by starting by definition of what is asthma. Asthma is a chronic inflammation of the airway. That is, inflammation means swelling. Now, swelling of the airway that is facilitated by a group of cells, immunity cells. We call them mast cells, basophils, eosinophils, prostaglandins, some of the immunoglobulins, and even leukotrienes. Those are our medical terms, but those are the group of cells and some of the molecules that trigger this inflammation. So it is a chronic inflammation, but it has also the external triggers that when you come across, mediate or facilitate, enhance the inflammation. So when you get the inflammation, you get the blockage. When the airway is blocked, when the airway is swollen, it gets blocked. So when your airway is blocked, you can't breathe. Breathing in is voluntary, meaning you have authority over it. Breathing out is involuntary. It is the physiology of your body that the movement of your ribs and your diaphragm to pull the air out. So meaning at certain instances, it can be disabled. You can't force the air off your lungs. So what happens when the air is trapped in your lungs? You've already forced air in. You've forced in, but it can't come out because of that inflammation. When you're forcing in, it passes through, forcefully through those inflamed or swollen airway, into the alveoli. But it can't come out because the gate is locked.
Yeah.
So what will happen? You will start having a lot of secretions. These secretions, where air is trying to come out, will produce some sounds. Whistling sound, what we call wheeze. So first you'll have wheezing. You'll have wheezing sound. Some will have cough. And if you have the gates closed, so you have difficulty in breathing. Yes, those are the three major symptoms of asthma. You must have wheeze, difficulty in breathing, and cough.
And a cough.
Yes, but again, you know, when you have congestion, chest congestion, you will have pain on the chest at times.
On the chest
yes.
at times. What are the triggers when it comes to asthma?
The trigger of asthma are categorized again, allergen and some other things like emotions. Some people get emotional and they get their triggers. Their attack is triggered by the emotions. Some also get, when they do exercise, extensive exercise, they get the attack. Some cold air with the weather, when they breathe in cold air, they get the attack. Some people, when they take bath with cold water, or they touch cold water, they tell me, when I touch cold water, I get the attack. You get the attack. Then the allergen, the group that we mentioned earlier, the pollen, dust, smoke, again cold air comes in, perfumes, and other things which may vary from one person to another. Yes.
So it may vary from one person to another.
True.
But you find that some asthmatic people have a reverse reaction in terms of the weather. Like when it's hot, you hear them complain that they're feeling cold. Or when it's cold, you hear them complain that they're feeling a little warm and hot too. What is the reason behind that?
During cold weather, they feel hot.
Exactly, and
during hot weather, fine. I'm not sure of whether there is a correlation between that and asthma, but that condition that you're saying is body chills, where you feel very, very hot when it is cold. And, sometimes you feel very cold when it is hot. Normally, very common during, when you have infection. Some of the bacterial infection will present with such kind of symptom. Yes. So I'm not so sure whether that happens in asthma.
But body chills are a reality with infections.
Yes, a reality with infections.
They are a reality with infections.
True.
When it comes to treatment or management of asthma, how are we supposed to go about it?
Management of asthma is patient-oriented. Us as clinicians, we diagnose. After diagnosis, we initiate treatment. The treatment will take some time. So most of the time, 80% of management or treatment of asthma, it is the patient who is treating himself. The first management of asthma is the patient identifying the trigger of the attack. Once you've gone to the doctor, or the clinician tells you that you have asthma, you have to get the trigger of your asthma. If you have history of allergy, if you have history of family history of asthma, all that, but you have to know the trigger of your asthma. When you know the trigger of your asthma, then the treatment become avoid that trigger. Avoid that trigger. Now, coming on our side, we will try to help your body not to react so heavily against the trigger. We will give you some drugs that will help you stabilize your muscles. Muscles is one in the group of those mediators that I mentioned earlier that is causing the inflammation. We have some drugs that we give tablets. The commonest that we give currently is Montelukast. It's a drug that you're given once a day for a period. Some people will give 2 weeks. Some will give up to 1 month, depending with the severity of the symptoms. Ideally, like during this season, that there is change of climate, it's cold, we maintain asthmatic patients on such kind of treatments. They are called leukotriene, muscle stabilizers. So they help stabilize the muscles. You take them once a day throughout. You better take them in the evening when you're going to sleep. Then we give you the controller drugs. Currently, we give controller steroids, which we give as inhaler. Controller steroids are very good, and they help the patients not to get the attack. They control again the overreactivity of the body towards such kind of allergen. So there is an inhaler that doctor will tell you that this one you use every day, in the evening, in the morning, and in the evening. Morning you are going out there if you are allergic to dust, if you are allergic to smoke. Somebody will be smoking or you will be passing wherever. If you are allergic to pungent smells. So you take it in the morning. Again in the evening, you take another puff. That controller inhaler you have to use throughout. Then there is an inhaler that we use, Ventolin inhaler, that we use to relieve in case somebody smoked and you got the attack. You need to relieve yourself. Yes, you need to relieve yourself using the inhaler. Yes.
So there are types of what I get is that there are types of inhalers.
True, there are types of inhaler.
And it is dependent on what exactly you're going through. Is it a trigger or do you need to control it? That's what I hear from you this morning.
Yes.
Exactly.
Yes.
So we should sensitize our viewers this morning that this whole thing of, going over the counter and requesting for some of these things, it's not recommended. Visit a doctor. Visit a doctor. Let them examine your history and what exactly symptoms you have, so that they're able to give you the right kind of medicine. Remember, if you get it wrong, you're only compounding the problem. If you get it wrong with the medication, you're compounding the problem. So visits to the doctor are very, very critical, especially when it comes to some of these infections and attacks, asthma being one of them. However, Daktari, you said it is very patient-oriented, how we go about treatment and management of asthma. And the first step is know your trigger and stay away from it. However, we may not be 100% safe. When a patient is at home or when a patient is out there in society mingling, what are some of the critical essentials and quick facts or knowledge they should have in managing their condition? Because if my trigger is perfume and I show up in a wedding, I may not control what perfume who is wearing.
True.
Yeah.
One of the most critical things that you need to do is to have your drugs everywhere. Have your inhaler. In fact, some pharmaceutical companies have made the inhaler in a very friendly way to avoid even the stigma. There's one called Aquihala, where it's very nice. It's nice looking, and you load the drugs and just inhale on it. There is also Ellipta. This is the current technology. You even don't have to inhale. You just you don't need to load the drug. You just have it in your mouth. It's a very nice one. I wish I carried one here with me. You need to have your drugs everywhere with you. That is one. Two, you need to take your drugs. If you're supposed to take the inhaler, you have two types of inhaler, or you have one type. Nowadays, there are some drugs that are combined together, the steroids and the relievers. Controllers and relievers are combined in one inhaler. You take in the morning and in the evening. If you're supposed to take them, honor the prescription. Take it the way it has been prescribed so that you don't get the attacks. But in case you do the attacks, have your reliever. Take it. That is the only thing the only precaution that you will need to take. Because you cannot control, even, for example, if you are allergic to dust, we're living in a dusty nation. Yes, there are dust everywhere.
Yeah.
Yes, so you will get the attack, but you have your reliever. Yes.
And issues of medicine sort of complement with nutrition, isn't it?
Yes.
Is there any aspect of nutrition maybe someone should be sensitive to, or a point of knowledge that touches on nutrition that we could share with our viewers this morning?
In relation to asthma?
In relation to asthma.
None that
and
I'm aware
even
of.
common cold maybe.
None that I'm aware of. Because asthma is purely in respiratory system. And unless there is somebody is getting the trigger by eating some foods, maybe. But when it comes to asthma, your immunity is good. And it is your immunity that is causing problem. Yes.
It's the immunity that is causing the problem.
Yes, it's immunity that's causing the problem.
And usually with asthma especially, I won't dwell much on common cold, but especially asthma, you will find that there are some myths associated with it. And it's only fair this morning that we demystify myth from fact when it comes to asthma. So what are some of those pointers you can share with us this morning? Myth versus fact when it comes to asthma.
In my clinical practice, I've seen most of the patients would ask me, is this disease curable? That is one. I would want to clear the air that according to the WHO, asthma is not curable because it is within your cells. But you are only asthmatic when you get the asthma attack. I can be having the asthma. I can be asthmatic. But I got my attack 10 years ago. Am I still asthmatic? I'm a normal person. If you get your attacks frequently, you are asthmatic. So meaning asthma, if well controlled, is kind of curable because you are out of the symptoms. You don't wheeze anymore. You are okay. Asthma in relation to pneumonia, there are two different things. Pneumonia is infection of the lungs. Asthma is inflammation of the airway. They're two different things. So find chronic asthma, which is very rare, can result into infection. But asthma and pneumonia are two different things. You may be treating yourself for pneumonia, refusing the diagnosis of asthma. I've seen so many patients, if you want to make a diagnosis of asthma, they will tell you, no. In fact, they tell you, ishindwe. Some patients will say, ishindwe, that is, I don't have asthma. Okay? There are two different things. Okay? Asthma, initial stages, we call it hyperreactive airway disease, where your airway is very reactive. It's true, but if that airway reaction, hyperreactivity is treated, you go back to normal. That airway, hyperreactive airway can be treated in the same way we treat asthma. So you still need to take your medications. Another myth, that there is none that I can remember of. Yes.
Let me take you back to the first two about will I be cured? Will I ever be cured?
True.
And you said, according to the WHO, asthma is more managed than cured, right?
True.
But then point two, you said if you had an asthmatic attack 10 years ago, like your last attack, is it would you qualify as someone who would say, I have asthma? I mean, a decade later. The contrast then begs, Daktari, what happened to this person who had an attack 10 years ago? Didn't they get cured of it? Or what exactly happens there?
If you are allergic to pollen, when you are staying in a farm and you get asthmatic attack, then you decide to move out of that farm. You stay in the city now. For 10 years, you don't get the attack. Are you still asthmatic? I would say, yes, you have hyperreactive airway. And the trigger, you've eliminated the trigger. Are you getting?
Yeah.
Yes, you've eliminated the trigger. Yes.
We go back to the point of it's patient-oriented.
Yes.
Identify your trigger, stay away from it, you will be fine.
True.
But keep predisposing yourself to conditions that, you know, bring the trigger with it, then definitely you will fall prey to some of these things. I think that is very important to note.
True.
Know the trigger, stay away from it. And earlier on, I'm very sure if you began with us this discussion this morning on asthma and common cold, you realize that common cold, I'm a homa, see homa too. There's so many things, man, that you need to consider. There's so many things that you just need to be in the know of. For example, self-medication is dangerous because it leads to prolonged symptoms. And also there are things that you need to embrace on a day-to-day basis. Keeping warm, for example, that is basic common sense given the weather. Keep warm. Do not predispose your body to a lot of cold, because then again, the infection, or it's a viral infection.
It's a viral infection.
It's a viral infection. It thrives in this weather. So be careful. If you have a common cold, it's okay. Daktari says take a bed rest for 3 days. Tell them Good Morning Kenya Health Tuesday gave you a bed rest. But you still need your job after that. So go about it the right way so that you're able to be in isolation and recover effectively. Stay away from children as much as possible. True. But then again, lactating mothers, how do they help this kind of situation? Uko na homa na uko na mtoto unanyonyesha. How do you help yourself?
Remember you asked me about other conditions.
Yes.
In relation to common cold. Now, these are some of the conditions that we'll consider even when treating. Those are the patients you want to initiate on medications of us so that they don't get this symptom for they don't stay with these symptoms for a long time, a long period, because there's likelihood of infecting the child. Yes, so those are special conditions.
Absolutely. Peter Okumu, thank you so much for coming to the show.
Just let me, maybe to mention one thing.
Yes.
You realize that there's some patients, the patients that we put on inhalers and especially the controller drugs, and they get hoarseness of the voice. I wish to say that it's important that after you've taken the inhalers, especially the controller drugs, you need to sip some water so that you don't get the hoarseness of the voice. It's important. I wanted just to mention that.
That's very important to note. So as soon as you administer the inhaler, sip some water.
Yes.
It will clear the whole hoarseness with your voice, and you will be a better person. Okay? Thank you so much for coming. We will keep engaging you on a frequent basis on issues to do with non-communicable and infectious diseases. Of course, today we're just setting the platform and discussing some of these issues, because it is important that you have this information with you. Information is power, and when it comes to health, we say prevention is usually better than cure. We do hope that the discussion this morning has been insightful enough for you to know how to embrace the rest of or the remaining season or time of this very cold weather. My name is Samuel Njoroge. Enjoy your Tuesday. God bless you all abundantly, and thank you for watching Good Morning Kenya.